Brain tumor and brain cancer, is there a difference? Hi, I'm Dr. Sharon Casilda Theophilus, and I'm a consultant neurosurgeon in KPJ Johor Specialist Hospital. I'm here today to tell you a little bit of what is brain tumor and what is brain cancer. All brain tumors are brain cancers, but not all brain cancers are brain tumors. This is the same with anything, any tumors in any part of your body. Basically, when you're talking about brain cancers, we're talking about malignant tumors, and brain tumors are tumors that can be non-malignant. So we have something called primary brain tumors. Primary brain tumors are tumors that can be divided into brain cancers and brain tumors. So if they fall in the group of malignant brain tumors, then they become brain cancers. However, there are also tumors that come from other parts of our body that can metastasize to our brain, and those also can be called brain cancers. So tumors in the brain can occur anywhere in your brain. So the brain is just as big as a city, and you can say it comes from the north, south, east or west. So in the brain we divide it into the frontal, into the temporal, into the occipital, into the parietal lobes, and then of course your cerebellar lobes, and then there's of course the brainstem, the vital part of the brain. And every part of the where the tumor occurs gives us different symptoms depending on which lobe it develops in. So locations of tumors in your brain depends on whether it's a benign tumor or a malignant tumor. Most of the time, benign tumors happen more superficial in the brain, so the symptoms come a bit longer, and they usually present with symptoms like headaches. Whereas if a tumor is a cancerous tumor, it's usually more deep-seated, so the patient will come with symptoms such as weakness on one side of the body. Sometimes they will also have consciousness, impaired consciousness. If the tumor is more in the frontal lobe or in the temporal lobe, they can present with seizures. In the frontal lobe, they can also present with change of behavior. In the temporal lobe, they can come with change of emotional behavior. They can become more emotional. They can have change of character, have lack of inhibition. If the tumor is in the cerebellar part of the brain or is at the posterior part of the brain, right at the back, then you can have problems like imbalance. And sometimes tumors arise from your nerves in the brain, and that can affect like your vision, your hearing, your swallowing, then you tend to choke. These are common symptoms you can develop. If it's brain cancer, usually it takes a very short time for the patient to manifest with symptoms. But if it's brain tumor, as in a benign brain tumor, it can be years. You can have a tumor in your brain growing for years and suddenly just present with seizures or present with something like a change of behavior. However, when it comes to brain cancer, because it's a very short duration, usually about 2 to 3 months, you come in with more acute symptoms. And so that's why you seek treatment faster. So how do we treat brain cancer or brain tumor? Depending on the imaging. Usually the imaging can guide us and can give us a clue whether it's a malignant tumor or is it a benign tumor. Normally benign tumors are well demarcated and they're more superficial, so they're more easier to tackle. We can use adjuvant or add-on equipment such as neuronavigation to help us locate the exact spot of the tumor. When it comes to brain cancers, however, if they are malignant tumors, it depends on the location of the tumor. If they are in a non-eloquent areas, that what we mean is an area that will not affect the patient too much neurologically or cause any kind of harm, then it's easier for us to excise the tumor. However, the tumors, if it's deep-seated and we presume that it will cause a lot of damage to the patient, then most of the time we take a biopsy. Here again, biopsies have an issue because it depends on which area you're taking the biopsy. If you take a biopsy at an area where it's high yield, then you might get a better pathological diagnosis. However, sometimes you can take a biopsy at an area where there's a lower yield, and then it ends up having a different diagnosis. So malignant brain tumors in the brain, which are primary brain tumors like glioma, we call them gliomas. And gliomas can be divided into different grades. You can go from grade 1 to grade 4. And now we have newer technology that actually delineates whether it's through molecular testing what kind of a grade level it is. So if it's a higher grade tumor, then of course the treatment is more aggressive. Patient is given chemotherapy, radiotherapy following the surgery. If it's a lower grade, then our aim is to actually have a maximal safe resection of the tumor and then follow up with serial imagings and see if the tumor does grow back. So this is the way we treat tumors, and of course there are a lot of recent technology that actually helps us to manage these tumors safely. And so the outcome for patients are better. However, again, if it's brain cancer, its prognosis is still guarded, because even though you remove the tumor, the cancer cells still can grow. All right, and whatever treatment we do is just to prolong or try to reduce the side effects of the tumor itself. Patients which have brain cancer usually depends. Okay, some do well and can live for an extra few years, but sometimes the tumor does come back again aggressively, even though they've completed everything and the tumor was actually successfully removed. So these are sometimes difficult to prognosticate, but now because we have molecular studies, this does help us to sort of give the patient an idea of their prognostication. Some brain tumors can be hereditary, and they can be picked up to genetic testing. Usually they are chromosomal defects. This can be picked up, if you have family members that actually present with brain tumors, and they seem to present to the doctor. Usually the doctor, a neurosurgeon like myself, will realize whether it's a hereditary kind of a brain tumor, and then we will actually advise the family for them to go and do genetic testings so that they can actually quickly pick up on whether they have this hereditary kind of symptoms or brain tumors. And what we do is we usually can advise the family to follow up with serial imaging. It's usually MRI, where they can actually detect early if they have tumors like this in their brain. Because some of these tumors don't need surgery if they're picked up early, and they can undergo treatments such as stereotactic radiosurgery. These are tumors that actually arise from nerves sometimes, and sometimes there are other kind of tumors depending on the genetic testing. All brain tumors are actually dangerous because brain tumors develop inside our brain. And our brain is actually a skull, which is hard, and the brain is inside the skull. Unlike other parts of our body where we have a tumor, there is a space for it to expand. However, in the brain, as it gets larger, it sorts of pressures on a lot of vital structures in our brain. So even if you have a benign tumor that's slow growing, over time it will cause symptoms. It will cause neurological deficits such as you can go blind, you can lose your hearing, you can even lose your memory. And even though it's benign, some patients think it's okay. However, these kind of tumors, as they grow, they can cause you to have sudden death. Right? So brain tumors in the brain are dangerous. They need to be treated early. As soon as you have symptoms, warning signs, you need to go and see a doctor to be diagnosed early and treated early. And if you're treated early and if they are benign brain tumors, you actually lead a very long and healthy life. I hope it's been a very informative session today. If you have any questions, just reach out to us, and thank you for watching Medical Channel Asia.